Based off the 2 lead applied, we were able to interpret that the patient is in the rhythm supraventricular tachycardia. Supraventricular tachycardia is characterized by the narrow QRS complexes, no discernible P waves, and being over a rate of 150 beats per minute. In addition to the vitals, patient must have a systolic blood pressure of over 100 millimeters of mercury and have an unaltered LOA. It is confirmed that the rhythm is not atrial fibrillation, flutter, or sinus tachycardia. We will now perform the modified valsalva maneuver. Before starting, the paramedics will inform the patient of the procedure of what is going to happen. The modified valsalva maneuver starts by positioning the patient at a 45-degree angle, where then they will instruct the patient to blow as hard as possible into the 10 millimeter syringe for 15 seconds. After the 15 seconds, we will lower the patient's head to a supine position while simultaneously lifting the patient's legs to at least a 45-degree angle. We will remain like this for 15 seconds, and then we will return the patient to a semi-Fowler position, recheck their vitals and their rhythm to determine if a second round of the valsalva maneuver is appropriate. From the first valsalva maneuver, the patient has returned to a normal sinus rhythm as shown on the paramedic's ECG, and the patient is now asymptomatic. We are able to perform a second valsalva maneuver, but it has been deemed that a second valsalva maneuver is not needed for this patient. The patient now states that they feel fine and does not need to be transported to the hospital. The patient is adamant on staying home, so the paramedic will now go through the treat and discharge process with the patient to see if they check all the boxes for the treat and discharge requirements. The patient must meet all of the following criteria. The patient is above the age of 18 and below 65. Patient must have a prior history of SVT. The patient presented with narrow, complex, and regular rhythm SVT. The patient must have had only one single SVT episode in the past 24 hours. The patient has returned to normal sinus rhythm either spontaneously with a valsalva maneuver or with adenosine treatment by paramedics and is now asymptomatic. The patient has returned to their normal level of consciousness. A complete set of vitals are within expected normal ranges with a heart rate below 100 beats per minute, and the patient remains in normal sinus rhythm for at least 15 minutes post-conversion, and the patient was not treated with electrocardioversion by the paramedics. The patient isn't pregnant. The SVT must not be related to alcohol or substance abuse or withdrawal. The patient has no fever or preceding illness. And in addition to these above criteria, if all the following requirements have been met, the patient can be discharged by the paramedics, where a responsible adult agrees to remain with the patient for the next 4 hours. All of the patient or substitute decision makers' questions were answered and a care plan was developed for them. The patient or substitute decision maker has been advised to follow up with their primary healthcare team or provider. Clear instructions to call 911 were provided should symptoms redevelop. Patient or substitute decision maker has the ability to access 911 should symptoms redevelop. Patient or substitute decision maker consents to the discharge.